In today's video, I'm going to talk you through how to diagnose Achilles tendinopathy or tendonitis from the comfort of your own home. And we're going to start right now. If we haven't met before, then welcome to Genuine Physio. My name is Luke Skembury and I'm a senior musculoskeletal physiotherapist from the UK. If it is your first time to the channel and you'd like to learn more about Achilles tendon pain and any other pain or rehab related issues, then start now by clicking that subscribe button and tapping the notification bell so you get notified every time I release a new video, which I do every single week. A good place to start is probably working out what it is actually called. If you look online, it can be a bit confusing. Some people refer to it as tendonitis, some people refer to it as tendinopathy. Now, back in the day, we did call it Achilles tendonitis, and the itis part of the word refers to inflammation. We now know that there is not always an inflammatory response going on if you have Achilles tendon pain, so we've moved towards calling it Achilles tendinopathy. Now, your Achilles tendon is a fairly incredible bit of tissue. It is the thickest tendon that we have in our body, and it's obviously fairly visible. Now, the reason it's so incredible is because it's able to tolerate very high levels of load. So during our walking cycle, we have up to 4 times our body weight going through the tendon. And during running, we have up to 8 times our body weight going through that tendon. Now, this is really important to understand when we talk about rehabilitation in other videos on the channel. Now, your Achilles tendon is made up of 3 muscles kind of merging together in the lower leg and then blending to attach into the heel bone. Now, those 3 muscles are your gastrocnemius. That's the one that we can see. If you look at somebody that has a well-defined calf, sometimes you can see those 2 heads coming up and attaching in behind the back of the knee. So the gastrocnemius is the biggest muscle on the outer side. Underneath your gastrocs, you have your soleus. So that muscle does not cross the knee joint. That sits below the knee joint and travels down behind the gastrocs and into the Achilles tendon. And then you have a thinner muscle called your plantaris, which attaches on the outside of the thigh bone and then travels down the inside of the calf and again into the Achilles tendon. Apologies if that sounded like a boring anatomy lesson, but it's important to understand where these muscles attach because that will have a bearing on your rehab. Now, if you have had a look online at exercises for Achilles tendon pain, you'll often see that heel raises are given. So when you're standing still, bringing your heels off the floor and slowly lowering down. Now, if you complete this exercise with a straight knee, because your gastrocnemius attaches past the knee joint and into the back of the thigh bone, you'll be working on that muscle when you do the heel raises with a straight knee, whereas if you complete the exercises with a bent knee, which is often neglected, you're working on your soleus. So in a robust, efficient rehab program for Achilles tendon pain, you should be doing your heel raises with a straight knee, but also a bent knee, so you're targeting both muscle groups. Anyway, I digress. Today's video is not about rehabilitation. In terms of the role of the Achilles tendon, its role is to plantar flex the ankle. So that is the movement where you point your toes away from you. It also has a role in the flexion, the bend of the knee, like we said, because your gastrocs passes the knee joint. It's used all of the time, every day during common activities like walking, hopping, jumping, landing, and running. Moving on to diagnosis, a good place to start would be discussing some of the things that your Achilles tendon enjoys. Now, it enjoys load, it enjoys exercise, as long as those things are gradually built up sensibly over a period of time. It enjoys good nutrition, good diet, and it also enjoys you having a good night's sleep because this is when your body does most of its recovering and repairing. In terms of a few things that your Achilles tendon does not enjoy, well, basically the opposite of what I've just mentioned. Poor diet, poor sleep, and poor load management. And load management is the key thing when it comes to discussing diagnosis, but also treatment for Achilles tendinopathy. So when we talk to people who have Achilles tendinopathy, there is normally some sort of change in load. Now, regardless of the tissue anywhere in your body is very, very good at adapting to things as long as they are done gradually, progressively, over a period of time. None of the tissues in our body respond very well to quick or sudden changes or significant changes in load very quickly. We also can't ignore the fact that increases in load include weight gain. Now, Achilles tendinopathy is quite common in people who are overweight, and there's two reasons for that. Now, we understand that obviously if we're heavier, the more load we have going through our tendon, the more load the tendon needs to tolerate. But the second reason, which isn't so commonly understood, is that the more fatty tissue that we have in our body, so adipose tissue it's called, the more inflammatory chemicals we have in our system as a result. And obviously inflammation is not good news for joint health, but it's also not good news for muscle and tendon health either. So changes in load would be the first thing that we consider in terms of diagnosis. Now, generally an Achilles tendinopathy will come on gradually over a period of time, with your symptoms being very mild initially and maybe potentially getting worse if you continue to load it. Now, it's very rare for an Achilles tendinopathy to come on suddenly. If it is a sudden onset, then there is a chance it could be something else, maybe a calf strain or a calf tear, or maybe even Achilles tendon rupture. But if it is a complete rupture of the tendon, then your symptoms will be quite significant and severe. There should be bruising, swelling, difficulty in weight bearing. People often describe that they feel like they've been hit in the calf with a baseball bat. You may even hear an audible pop of a tendon. So we're thinking gradual onset, change in load. Another symptom that you may have if you have Achilles tendinopathy is stiffness in the tendon. Now, typically this will be first thing in the morning or after you've been sat down for a prolonged period of time. Typically you'll get up and the first few steps will be uncomfortable, and then it gets better with movement. And actually timing this stiffness is a very good marker for your improvement going forwards. For example, when you first start your rehab program, you may have 20 minutes of stiffness, but if you've been doing it for 6 weeks and you only have 10 minutes of stiffness, you know that that tendon is responding quite well to the program. So even before we do a physical assessment, we should have a fairly good idea as to whether you have an Achilles tendinopathy or not. And then really the physical assessment is just to kind of back up that hypothesis. But let's take a look at some of the things that we would consider in a physical assessment. So we're going to do the assessment in this angle just because this is how you're probably going to be looking at your tendon at home. Now, the first thing to point out if we look at the location of pain is that you can have two different types of Achilles tendinopathy. Now, the first one is called a mid-portion tendinopathy, and that kind of is what it says on the tin. So you have your length of your tendon, and then towards the middle of the tendon, the bit that we can see most prominently, that tends to be where you can get your pain. That's more common. The second one is called an insertional Achilles tendinopathy, and that refers to the fact that you can get a tendinopathy where the tendon inserts into the heel bone. So you may feel like if you have this type of tendinopathy that it is more heel pain than tendon pain. So if we talk about location, Achilles tendinopathies tend to produce very localized pain. So if it's a mid portion, it will be very local to the mid portion of the tendon, whereas if it's a heel, it will be very local to the heel. You don't tend to get referred pain into the foot. You don't tend to get referred pain into the calf. Pins and needles, numbness, those sorts of things would not be things that we associate with an Achilles tendinopathy. We might try and palpate the tendon because the tendon can be tender to touch. So you would do very simply squeeze either side of the tendon to see if it is uncomfortable. And again, for the heel, you would just push in and around the heel area to see if that provokes any symptoms. In more degenerative or chronic tendinopathies, you may even see structural changes to the tendon. So in a normal tendon, if you run your fingers down the tendon, it should feel fairly symmetrical and nice and smooth both sides. If you've had a tendinopathy for a very long time, you can get raised lumps or bumps along the tendon where that tendon has changed structure. Lastly, one thing that you could also see is weakness in the whole calf globally. And you can test this by doing a single leg heel raise and then comparing left and right. So if we were to say the left side is the affected side, we could do some single leg heel raises on one side. And you basically need to do as many as you possibly can until your calf does not let you do any more. And then you would do the same on the affected side and compare left and right. Now, this isn't an accurate test, just because the other side may also be weak or load deficient, which obviously doesn't give you a great representation of what you're aiming for. But there is a table here that does. So this is a study that looked at normative values of people at certain ages that could do heel raises on one leg. They all had BMIs under 30, and you can see each category breaking down into different age groups. So this might be a slightly more accurate idea of what you're trying to aim for when you're doing your single leg heel raise. Thank you for watching. I would love to hear from you, so please do drop me a comment below the video and let me know if there are any points in the video that helped you diagnose your Achilles tendinopathy at home. And if you've enjoyed it, do give us a thumbs up and please subscribe to the channel. It helps the channel grow. It means more people will be able to see the content that you've found helpful. It also means you won't miss any of Genuine Physio's videos. If you have enjoyed this video, there's every chance you will enjoy the video that we have done on how to manage an Achilles tendinopathy, and there's a whole playlist on the channel to help you manage your Achilles tendinopathy better at home. Thank you very much for watching, and until next time, I will see you again very soon.